Hi everyone, I'm Parsa here from Parsa Wellness Clinic. Today, I am lucky enough to have Dr. Soltani here, pain practitioner and anesthesiologist, to talk about what chronic pain is really. So, Dr. Soltani, welcome. Thank you for joining us today.
Thank you for taking your time and to having this interview with me.
It's a pleasure. Thank you so much. So let's dive in straight into the questions. My first question for you is, you've been treating pain for about 2 decades. How do you define chronic pain and why is it so often misunderstood?
The International Association of Studying Pain defines pain as an unpleasant sensory or emotional experience that associate with or without tissue damage. To be honest with you, pain is one of the most challenging symptoms to talk about and also to treat. Because even some doctors or patients think that when they don't have any tissue damage, the pain is not real. But I am telling you, pain is real even if we don't have tissue damage. Pain is not imaginary. In fact, we have two broad spectrum of pain. One is acute pain and one is chronic pain. And although these two have the same neurophysiologic pathway, but they are significantly different regarding their mechanism and also their causes. When we talk about acute pain, which is something that most of the people have insight about that when we talk about pain, is that is always coming with a tissue damage and is showing us that there is a harm in the body. And basically, acute pain is a mechanism, is a protective mechanism for our body. It usually has a clear cause, so it can be a fracture, a medical condition that caused this pain. And also, it has a very localized sensation. So it's just in one part of your body, you feel that one, and this is a message from your brain to tell you that something happens there. And usually it goes away when that injury or the pathology part is going away. In contrast, chronic pain is a very persistent and also very sometimes it's recurrent pain sensation that can last for months or even years. It doesn't have a very clear underlying cause, and usually it relates to the other factors like some psychological factors, social factors. And because of that, it's very challenging to define, explain, or even diagnose. It's debilitating, and also it can affect people's lifestyle and also their functional status during the day.
And you mentioned that chronic pain can exist without an ongoing injury. How is that even possible?
This is another very challenging question to answer because still even researchers don't know what causes that acute pain converts to chronic pain. They have some important points to mention when they want to define this, but to be honest with you, there are lots of dilemma about that yet. But what I can tell you is that chronic pain is about brain processing the pain. And this is the disorder. This is the dysfunctional part. Is not the tissue damage. basically, brain processes everything in our body. Our body is covered by nerve cells, in and out. So, but whatever we do, brain understands. If we are hungry, if we are thirsty, cold, hot, or wet. If we just hit our body to somewhere and then we get a fracture, our brain understands this and tries to send us some message to inform us about that injury. And based on that, we are going to have some protective behavior. Also, this can activate some interactions or mechanisms to protect our body or heal the tissue damage that happened. And then when that damage is gone, then brain again needs to help us to forget that pain. This is the problem that happened. If the brain is not doing its job at this point very well, so it's not going to forget that unpleasant stimulation, and it also always just remind us about that pain. So the processing of the pain is again and again and again, although there is no tissue damage over there.
That's interesting.
The problem is that this is one thing that happened, and pain is stressful. And stress is also causing some other processes happening in our body. And this is called a stress response, and is the job of the sympathetic nervous system. So the body starts to activate that the sympathetic nervous system, which is the fight and flight response. And now we are getting even more problem because the other problems, the other symptoms are coming together with the chronic pain, and brain is always in the protective phase. So, and always trying to send a message, and this is going to be in a very negative field or negative loop. So brain sends the messages of the pain, sympathetic nervous system gets that and sends some protective messages. So this is the reason that although there is not any tissue damage, but in our body, still we are doing some reactions and behavior that make the chronic pain and other symptoms.
Well, that's interesting. I don't think any of us ever knew that. That's a new concept for all of us. That doesn't have to be a physical injury or something that happened. Pain can be, within our bodies without us even realizing where it's coming from. Moving on, what kind of symptoms go beyond pain in chronic pain patients?
So as I mentioned, because of the stress that pain causes in our body, sympathetic nervous system is going to be activated and causes some stress response, including dizziness, feeling numb, mentally feeling depressed, sleep can be affected, and also we get some other symptoms like IBS, irritable bowel syndrome, means that people get diarrhea, they can be nauseous, also they can get even bladder pain. And all of these are just getting the brain energy, to be honest with you. And this is causing people with chronic pain to feel always tired and exhausted. So in general, these are the most important and most common symptoms that are always with chronic pain.
And should someone come across any of these symptoms like regularly, they should automatically just assume that it's chronic pain? Like what do you usually recommend for them to do?
We don't really recommend them to just do something about these symptoms, but consider that even if these happen to them, they don't need to be worried about that. These are again some signs of tissue damage. They are also some symptoms that are accompanied with that chronic condition and pain that they have, and is just the stress response in their body.
Let's move on into what triggers chronic pain to begin with.
Chronic pain can be triggered with anything, to be honest with you. It can be triggered with other kind of pain, other kind of medical conditions like cancer, or when we have an injury into our body, we have an motor vehicle accident, burning. So these are all triggers. Even some stressful event in our life, or some in some situations that our mental health has impaired, we can have a trigger of the chronic pain. But the most important thing to remember that these are triggering factors. They are not the cause of the pain. The cause of the pain, as I mentioned before, is the impairment of the pain processing in the brain.
And what happens if chronic pain isn't addressed properly or left untreated?
If we don't really care about the pain and it goes to the chronic phase, there are some significant changes happen in our body that can affect a whole life, to be honest with you. The most important ones are peripheral and central sensitization, and also we can have maladaptive neuroplasticity, and also involvement of the immune system and inflammation pathway. By peripheral sensitization, I mean, in simple words, means that our body is going to be more sensitive to any stimulation. So those stimulations that were not painful before, now they are felt as pain. So I have seen people that even when you rub their skin, they are screaming. So this is something that needs to be even pleasant and enjoyable when you just rub someone's hand, but they scream because of the pain. Central sensitization means that at the level of the brain, that impaired processing of the pain is getting even worse. So brain, any kind of message that goes in, just translated to a very unpleasant stimulation, and people pain is going to be amplified. And then because when the pain persists and is not going away, in the spine level and also in the brain, we have some structural and also functional changes. And this is affecting the pain modulation and processing the pain. So in the future, for any kind of other reasons, if we have pain, which needs to be actually protective for us, is causing more and more problem. Because of that, so most of the clinicians try to address the pain before getting to that point, and try to just not to ignore the pain. Otherwise, after a while, it's going to be much more complicated to diagnose and much more complicated to treat.
Your program at Parsa Wellness for pain management is called Turn Pain into Power. What does that really mean to you, and how is your approach different?
Turn Pain into Power program is a multimodal pain management model that is looking at people and their pain very individualized. We are using different modality to address the pain. It's not just about giving people medications or encourage them to do some physical rehabilitation, for example. pain has very, very complex cause that we already talked is the brain processing disorder, and that disorder is not something to be treated with just giving people some pills or doing some injection or sending them to physiotherapy. The main part of this program is to educate people about the science of the pain and what is the exactly cause of the pain, about the specific condition that they have, and also about the strategies that can help them on top of medications or injections to overcome their pain, and also what resources are available for them to treat their pain. We usually start with an evaluation of the patient, so to find out about their background, their other medical issues that they have, and based on their symptoms, their even mental status, psychological risk factors that they have, social risk factors that they have, we are coming up with a multimodal pain management plan, which includes medications for sure, injections for sure, but on top of that, some alternative strategies and complementary strategies, including physical rehabilitation, also optimization of the psychological status, for example, counseling or doing the mindful practice, meditation, and also we are addressing the other medical conditions that they have. We believe that with this approach, we not only try to treat their chronic pain, we are making them ready or skilled to overcome any kind of chronic condition that they have.
That's awesome.
And this is the very good
awesome.
part of the program, that we are preparing them to make some changes in their lifestyle, even in their diet, to overcome any problem that in the future that they can have, or even prevent to have any mental health problem or any other chronic condition.
I get you. And that's an awesome approach to have. I want to challenge you a little bit. This might be a little bit of a difficult question because there's so many diversity of chronic pain that could be going on. But what would you say to someone who's been living with chronic pain for years and feels like there's nothing is helping them?
First of all, I can say that they have to care about their pain, even if they are told that their pain was not real sometimes. If no one could find any tissue damage in their body or any other problems in their imaging or blood work or blah, blah, blah. So they have to care about the pain. They need to believe that their pain is not imaginary, but they need to target the part that is exactly dysfunctional. And as I said, so the pain processing in their brain. And they need to start this journey with going to some centers that advocate for this, chronic pain management modality and strategy. And also they need to be patient and believe that by using these different kind of modalities and strategies, although they seem that they are not really related to chronic pain, but they are helpful. And that would be the best approach to chronic pain. Otherwise, just getting one medication or one injection or just doing some kind of physiotherapy or chiropractic, these are not going to be enough. So everything should be together and needs to be seen at the level of their psychological and mental health status, their social status, and also the other backgrounds that they have.
Thank you so much, Dr. Soltani. That was such a powerful and precise deep dive into chronic pain and how it works. I thank you for your time.
Thank you for just letting me explain these things to our very lovely clients and patients in Parsa Wellness Clinic. And I hope that all the people can get this kind of treatment and services to address their chronic pain. And we are always here to help.
And so it was an absolute pleasure chatting with you. To my friends who are watching this from Parsa Wellness Clinic, if you're suffering from any kind of chronic pain and you feel like you've tried everything, allied health stuff, you've gone and done TPIs, you've done injections, any kind of medication that you've done, and you're at the last resort and you have no other place to turn to, we'd love to see you guys over at Parsa Wellness Clinic with the help of Dr. Soltani and her special team. All you need to know, there's nothing honestly that needs to be done. We only ask your lovely family care providers to give us a referral to Dr. Soltani for you guys to be visited over at Parsa Wellness, and we will build interventions for you, as she said, through many different ways. And not every single person's journey is going to be the same. There's no identical one, so that's why we like to make it customized for you. Thank you so much. We look forward to seeing you at Parsa Wellness Clinic. And with all that being said, this was just the first episode of many to come. I will be doing one-on-ones with all of our lovely professionals over at Parsa Wellness Clinic who are treating patients from organic chronic pain or various other specialties that we have. So stay tuned for more episodes to come.